He's one of our students, and he's going to be telling you about the joys of nursing school.
Hello. I didn't tell my parents or my girlfriend that I was going to be giving a speech, so surprise. They're looking at me going, oh my God, no. Hello, my name is John, and I'm a nursing student. Wait, I don't have to say nursing student anymore. I have all the power now. It's funny how I used to be the low person on the totem pole in Block 1, and then I gradually moved up the nursing school food chain to Block 4, where I'm on top, and then tomorrow I'm going to be back on the bottom again as a lowly new grad. And I still remember my very first day of nursing school. I walked into this classroom, I'm like, awesome, I'm going to be in a classroom full of women. Now, 2 years later, I'm like, get me out of this classroom full of women. I think my cycles have synced up to theirs. It usually happens like right around test time, too. Excuse me. Oh, I just got a text from Lori. The following message is not to be the intended views of the Glendale Community College Nursing Program, and is for entertainment purposes only. I would like to take a moment tonight. Is John Crawford here? I guess he's not here tonight. Maybe he'll watch the video, but I did want to take a moment to recognize John Crawford. He was our critical care instructor, and he deserves an award tonight for proving to students everywhere that an entire class of Scantrons can be graded and returned back to us in less than 10 minutes. I knew it! And somehow he was always able to find the one Scantron machine that wasn't broken. All the teachers were like, I'd also like to thank the DPS and the Glendale Police Department for not pulling me over on those days I was late to school. I did want to wear a suit tonight, suit and tie. First off, I think those gowns look kind of ridiculous. And because for the rest of my life now, I'm going to be wearing scrubs. Scrubs in all kinds of fashionable colors like cyanotic blue, C. diff green, fecal transplant brown. It still amazes me that those short-sleeve, ultra-absorbable cotton garments are the uniform of choice for people that spend their entire lives getting bodily fluid splashed on them. Never understand that. Possible MRSA, necrotizing fasciitis, so that's cool. I'm basically wrapped in a green cloth napkin. I just put on one of those like trash bag yellow gowns. I don't know what those are supposed to protect you from. Might as well wear one of those gowns to work. Ladies, of course, now you get to try to accessorize with your scrubs, which is basically just hair ties and shoes, and as much bling as you can fit on your little 3-inch badge. And what's with those big foam clogs anyways? I never understood when Dutch milk girl footwear became the standard for nurses. You girls try so hard to find your own original shiny clogs with hot colors, crazy patterns. Face it, they still look like old lady shoes. I was going to say something about Mary's shoes, but those clogs, you would never wear outside of a hospital. I dare you to wear those out with a skirt. Or even better, I dare you to wear high heels with your scrubs, because that's a sexy look. So shoes and hair, ladies, that's what you get to look forward to. And I think our fellow student Patricio has you beat in the hair department, just as long as he doesn't start wearing those foam clogs too. Patricio, we did have an award for you tonight, but I accidentally dropped it into the Sharps container, so you'll just have to reach in there and grab it, Oh, I got another text here from Lori. GCC and the Maricopa Colleges would like to remind all the kids here to never reach into the red Sharps containers. But going back to that first week, I thought it was interesting how quickly the pace changed. Day 1, we spent just introducing ourselves and reading the syllabus. Day 2, we spent an entire day learning how to wash our hands. Day 3 was blood pressures and temperatures. The instructors were all looking at us going, isn't this fun? Nursing school so easy? Blah, blah, blah. Then all of a sudden, day 4, we have 16 chapters to read, a 3-hour care plan to do, drive through rush hour traffic to pick a patient, do a case study, learn meds, meet with a mentor, and start practicing for the NCLEX. That's still 2.5 years away. And I don't think that pace stopped until just a couple weeks ago. And then, right after hand washing day, they give you this big red bag of dangerous toys. Needles, IV bags, catheters, fake bottles of meds, sterile trays, blood tubes, syringes in all different sizes. That's not an accident waiting to happen. That's like the race car instructor giving the student the keys of the Ferrari and going, here, just park it in the garage. You can turn it on, just don't drive it around for another 6 months to a year. It is funny how quickly diet and exercise fall way down to the bottom of the list when you're in nursing school. I'll admit I did gain a little weight in the abdomen. I got a buddy who calls it student belly, which I think might be contagious. I don't know, anybody else here get student belly, student butt, student thighs? I could show you my tiny little student biceps. You know, I wish instead of my belly growing that my head would grow in proportion to how much I studied. I imagine I'd have this huge brain that I could flex for people and really impress them, you know, veins bulging, a sweaty headband on. People would be like, hey man, are you juicing? You doing brain steroids? Like, no man, I'm on the nursing school workout. You know, P90 stress. They wanted to call it insanity, but that name was already taken. But seriously, anybody want to buy 700 pounds of books? They tell you to just go to the bookstore and buy the bundle. Now to me, a bundle is something small, like what train-hopping hobos would carry in a stick. Or what the kids in Charles Dickens' novel carried, you know, some books tied with a belt, skipping to school. Yeah, there's definitely no skipping to school going on with this bundle. I went to the bookstore to go get my bundle. They tell me, oh, you got a truck. Good, just pull it around to the back and the forklift's going to load it in for you. Like a forklift. It cost me as much in gas to drive those dumb books around back and forth to school as it did for me to buy them. I saw girls there pulling these huge Costco-sized crates just to wheel their books around. I'm like, what is this, some hidden agenda to strengthen our backs for lifting patients later? I've got med-surg books, farm books, lab books, drug guide, medical dictionary, critical care books, OBGYN, psych, nursing made easy books, nursing made not so easy books. And these aren't your typical 200-page textbooks either. No, these are like the King James version of textbooks. NASA doesn't even have textbooks this big. Some of them I barely opened. I'm serious, like the spines on them still crack, just like my back when I go to pick them up. I totaled up all the pages we were supposed to read according to the syllabus, 8,300 pages. And my friends wonder why I haven't been outside in 2 years. No, I'm not agoraphobic, I'm just a nursing student. And how boring are some of these books? I'd fall asleep at 3 in the afternoon trying to read some of this stuff. Oh, what's the matter, patient? Can't get to sleep? You don't need meds. Here, just read these 2 pages about zeroing transducers and call me in the morning. So then we finally had our first clinical day. It's that special day in every student's life where we'd actually take care of real people. It was our first time actually dealing with urine and loose bowels and sweat and vomiting and difficulty breathing. That was just us before we even went into the place. There were a lot of firsts for me in nursing school. It's the first time I ever jabbed a needle into someone's arm. It's the first time I ever carried someone's stool around that wasn't made out of wood or metal. It's the first time I ever wiped someone else's butt that was older than 2 years of age. And it was the first time I ever touched another man down there. Nonetheless, to shove a big rubber tube down it, that still gives me the creeps. Yeah, so we had our share of blood and vomit and open sores and stinky feet and, you know, bunches of feces, or to use that technical nursing term, poop. Our instructor, Mary, she gave us good advice, told us to use what is called the nurse face. That's used when you walk into the patient's room and you kind of start to gag or catch yourself before you go, oh my God, that's disgusting. No, you can't do that as a nurse. You got to just kind of take a breath and just put on your nurse face and go, I'll be happy to help you out with that. It is interesting how as you go through nursing school, you begin to self-diagnose yourself. Like every stomach pain I have now is diverticulitis. Or, oh man, I'm sweaty. Am I going into shock? Does my bowel movement look right? Am I getting enough magnesium? What's that tiny red bump on my arm? I think it's hives or melanoma. Can someone get just one measles? Because I think I have. It's even worse when you get to psychology class. You're like, do I have schizophrenia? I mean, I hear voices telling me to shut off America's Got Talent and go finish my kid. Am I bipolar? OCD? I am kind of dependent on my teachers, and I have been antisocial lately. And after that last test, I feel like I should be checked for dementia or maybe a learning disorder. Definitely a mathematic disorder or even a left brain injury. I know I definitely get a sleeping disorder before every exam. I did Google all those symptoms, and according to WebMD, I've only got 4 days to live, so that's going to be a problem. Those tests, man, those tests were probably the most stressful part of nursing school. We still have the biggest one ahead of us. We had one teacher that would try to de-stress us before every exam. She'd lower the lights, have us close our eyes, she'd talk soft, have us all do deep breathing exercises. Yeah, somehow that actually stressed me out even more. I just sat there thinking about all the information that was slowly draining out of my brain. I had just crammed it all in there the night before, and I'm sitting there meditating. We also had a teacher tell us some crazy statistic that something like 97% of all nursing students cheat in nursing school. I don't think she's necessarily talking about tests or homework. I think it's more like cheating on diets, cheating myself out of exercise, cheating our kids out of spending time with them so that we could spend 2 years reading about how kids develop. And is it really all the students doing all the cheating? I can't tell you how many times I heard nurses say, I know they told you to do it this way, but, or don't do what I do, that's not really according to the book. Or my favorite, there's the NCLEX way, and then there's the real world way. Well, can you just give me the real world test instead? It's interesting how we spend weeks learning about lung disorders or taking care of people on ventilators, measuring minute increments of insulin to control sugar problems. Yet during each break, out would come the cigarettes, Big Macs, 2 liters of Coke, Red Bulls, big whipped cream, Starbucks drinks. And I'm pretty sure I might have done some kidney damage at Buffalo Wild Wings a couple nights. Ironically, while I was trying to study renal failure. So this is how much of a newbie I am. Sometimes I hear nurses giving a report and I think they're talking about the patient's dinner tray. Oh, the patient has a big beefy stoma, a cabbage with some lung butter, a large banana bag, and she's been having some pink frothy sputum with that. Ooh, cabbage with lung butter. And if that was an actual dinner tray, it cost about $19,000. There's some really interesting words in nursing, too. Ones that sound kind of dirty, but they aren't. Like my favorite, mastication. At easy, it's just chewing your food. Or expectorated, that's spitting. Or eructation, it's burping. Middle schmerz, that was an odd one, that's labor pains. Oh, and how about the zazie? Yeah, it sounds fun, like a ride at the state fair, but trust me, you do not want to ride the zazie. Just ask your graduate about it. You know, so I haven't even gotten a job in healthcare yet, and I'm already experiencing the high costs. $350 for an NCLEX exam, $50 for a one-time use only gown, $250 in gift cards for our instructors, $1,300 for books. Like, what's up with all these high costs? It's Obamacare. I thought I was supposed to take care of that. In case you didn't know, here's the real reason for those lanterns. They really symbolize the fact that Florence Nightingale spent so much money on nursing school and books that she didn't have any money for electricity, so she had to fill out her care plans by lamplight. Did she even do care plans? Can you imagine Florence Nightingale's care plan? Patient at risk for sepsis, as evidenced by high fever, related to it being only 1860, and we have him laying here in a barn on a dirty butcher table with a musket ball in his chest. That's back when it really was necessary to spend an entire day learning how to wash your hands. They didn't even know what soap was. Like, Miss Nightingale, shouldn't you be wearing gloves for that? Oh, no, dear, in the 1860, we only wear our gloves to the opera. Oh, okay. It's interesting the dichotomy I have talking to my girlfriend about what I see in clinicals. It amazes me she doesn't want to know about the guy with MRSA who vomited on my shoe. Or the kid whose head grew 20 inches from encephalitis. Like, I find that amazing. I'm like, what do you mean you don't want to hear about the chest tube that got put in as I was holding pressure on the sucking chest wound? How is that just not so cool? I think it's fascinating. It's not dinner table conversation, I guess. And you know, here's the real part though. We all need nurses. Nurses are very special. Look what happens in those times when there are no nurses around. Dr. Frankenstein, he didn't have a nurse. Look what happened to his patient. Although he did have Igor. Igor probably got his hunchback from carrying his bundle of books around. Dr. Jekyll didn't have a nurse. Look what happened. Michael Jackson's doctor, no nurse. I'm pretty sure if there was a nurse, she would have been like, you want to give how much propofol, doctor? Are you crazy? You're not coming near my patient. Yeah, nurses are very special for that reason right there. And sometimes we do make mistakes. Like the time I was withdrawing meds out of a vial. See, the trick is to inject air into the vial so that it will withdraw into the needle. But I injected way too much air, which of course causes too much pressure, so that when I withdrew the needle, the patient's $50 medication splashed all over my face and hands. Then I almost succeeded in taking a patient's oral temperature with a rectal thermometer. Hey, that one's not my fault. Like, whose bright idea was it to make both thermometers look exactly the same? I think the rectal thermometer should be shoved in a big foam butt hanging on the wall. That's pretty explanatory right there. Nobody's going to make a mistake. And seriously, please, if you guys do make a mistake, just make sure it's not any of my family, okay? Hold on, I'm getting another text here from Lori. Oh, she must be giving me the wrap-up. She says I've been code blue for 10 minutes now. But hey, we all have to have a good sense of humor. We're all excited to go into a job where we're going to be surrounded by death and disease. You got to be able to laugh at that. So congratulations, students, we made it. That's right. Now let's just make sure that our names only get in the nursing magazines for good things. So now I'd like to introduce to you the Queen of Starbucks, Tiffany Manfredi.